Hi, I'm really fortunate today to be joined by Professor Isaac Manyonda. Professor Isaac Manyonda was a senior obstetrician and gynecologist at St George's Hospital, South London, and a professor in obstetrics and gynecology at St George's University of London, and recently retired. His focus now is on menopause. He was an accomplished minimally invasive surgeon and has had more than 25 years of experience in caring for ladies with menopausal symptoms. Welcome, Professor. Thank you for joining me this morning.
Thank you very much for the invitation, Catherine. Very much look forward to our conversation.
I'm really excited to speak to you. So I got in touch with you a little while ago and see if you would join me on a video because I thought this was a topic that we're going to discuss this morning that's not really spoke about very much. It's kind of something that not many women really speak about. It's not really spoke about on the internet. If you Google sort of this particular symptom of perimenopause on the internet, if you look for symptom trackers for menopause, you don't really see it mentioned. So the topic I wanted to speak to you this morning about is why some women might find an increase in libido when they go through perimenopause. So I think it's a really exciting topic to speak about. It did kind of come about to me because it's something that I'd sort of experienced when I went through perimenopause. And when I was Googling around, nobody had heard of it. Again, women, friends didn't speak about it. And I put a post up on Instagram a little while ago about this particular symptom after watching a BBC comedy that actually did raise this as a symptom in one of the episodes. And I got quite a lot of response from a lot of ladies saying that they'd experienced this as well. And I've spoke to women previously to this and after this, and they've all said, actually, yes, that's something that I'd experienced, and nobody ever told me about it. I thought there was something wrong with me. So it's a really interesting topic. So I wonder if you could shed some light on that. Have you heard of this before? Is this something that might happen, and the science behind why this might happen for some ladies?
Yes, I certainly I've come across it with some of my patients. And I must immediately reassure women that there is nothing wrong going on in them. And there are a number of explanations which I will share with you just now. But one of them is the fact that around the perimenopause, which I believe you said was the time when you noticed this rise in libido, which other women have confirmed the same to you. You'll be aware, sure, and many women will be aware that around the perimenopause, there are certain profound changes in their, say, for example, their periods. Their periods can become quite frequent, or they can become quite heavy, or suddenly a little bit more painful, or this just before they stop altogether. So it's almost like a swan song, really. The periods are saying goodbye, or they whatever. But what drives that? What drives that are the profound fluctuations that occur in the levels of hormones. And these fluctuations occur just before the menopause actually sets in. Some of the hormones, the key hormones are, of course, estrogen, progesterone, testosterone. So testosterone being one of them, as you will know, is a hormone that increases energy levels, improves sleep, in some women eliminates brain fog. But what most people really look at it as a hormone of is a hormone of libido. So it's known to increase a woman's libido. And if it rises, which it can do around the perimenopause in some women, well, their libido levels are going to rise. Mm-hmm. So it's just a physiological response to changes in the hormones.
Yeah.
And it is certainly not a pathology. It's not a pathological feature of the menopause. Yeah. And women need not be worried about it. What they need to be aware when it's happening is that when the menopause then sets in, there may be quite a profound fall in the testosterone levels. And when that happens, then they may notice quite a profound fall in libido as well. And for that reason, if they're aware of what's going on, they can then be in a position to perhaps take measures to even things out.
Yeah.
But Catherine, let me just pause there because I've said quite a few things and there are a few other things to say so that give you a chance to ask questions before I keep rabbiting on.
Yeah, I think that's really important. I think one thing you mentioned was being aware, and I think that's really important because I think even now there's so much in the media. Everybody's talking about menopause. A lot of people are talking about menopause, but I still think there's still not enough awareness out there. It's still not talked about enough as far as I'm concerned. But I think ladies still are not aware of what's necessarily happening to them. And I think particularly the younger ladies, because I think this increase in libido potentially does happen to the younger ladies prior to the other symptoms. And you're just not aware of it. So I think that awareness and things like this today is great to get that awareness out there. So then they can communicate. Because as you said, then there's going to be a dip. And if you've got your baseline libido, all of a sudden you're up here, then you don't go back to baseline, you go back there. And if you've got a partner and you've gone like this, you don't know what's going on. Your partner doesn't know what's going on.
Right.
And it's obviously going to cause a little bit of conflict in a relationship and your well-being, and you're going to think, well, what's going on? And
yeah, I think one of the things that people don't do enough of is talking about what's happening to them. And a lot of the time, if people could only just communicate and say, hey, this is what's happening to me. For some reason, I'm really very interested. And if put in the correct way, it's not delivered as a challenging message, which it can be if it's put wrongly. But if people could have a direct communication about it, say, oh, this is what's happening to me. And as you know, I am X number of years, and it may be that I'm also getting a bit of thin hair. I'm also getting a bit of a dry skin. My nails are breaking easily. And it may be that I'm knocking on the door of the change. And I did listen to a podcast that Catherine did, and it sounded as if the hormonal fluctuations may be causing changes in my libido. And that would help if people could have communications of that kind.
I think so.
If you just let me just say that the importance of recognizing what testosterone does is testosterone is actually produced by women as early as the age of 6, what is called the puberty. And then the levels begin to rise into the adolescence, and they rise also, and they become almost cyclical. And there's a lot of women, if they really stand back to think about it, they will know that around mid-cycle, their interest rises, their libido is increased. And that's a normal physiological thing to enhance the possibility of conception. Because nature wants us to conceive, nature wants us to procreate, nature wants to increase the population, if you like. So that's why the rise in testosterone, and the result of that is the rise in libido. And the levels of testosterone rise mainly in the mid to late 20s. And I think, again, a lot of women will recognize that the peak libido is around the age of about 28, range being about 25 to 35, something like that. And then it flattens out. And again, around the perimenopause for some women is the phenomenon that you just described. But also an added factor around the perimenopause is the sense of freedom that women sometimes develop. Which is to say, I'm not going to get pregnant. So, all the time before, I was worried, if I've taken enough contraception, or if the contraception burden was on him, is he going to be responsible enough? So suddenly a woman is saying to herself, well, I don't have to worry about those things. She becomes freer and much more able to engage, indulge, and so forth. But then the fall is largely purely hormonal.
I think testosterone is one of those, I think that's still not talked about enough as well. I think there's still a lot of people who don't realize that women do have testosterone as well. I think that's still
yes, absolutely. And yet actually basic biology does teach us that a woman's ovaries and another part of her body called the adrenal gland, a little gland that sits on top of each kidney. In these two areas, the ovary and the adrenal gland, testosterone is produced. And in fact, what often people don't realize is that a woman produces 3 times the amount of testosterone compared to estrogen.
Yeah. That's a lot, isn't it?
The estrogen molecule, however, and the testosterone molecule are very closely related when you look at their structure. And in the normal body, the testosterone is in fact converted to estrogen. There's an enzyme called aromatase, and its job is to convert the testosterone to estrogen. But the idea that testosterone is a male hormone and estrogen a female hormone is really a misconception.
Yeah.
Women have testosterone and they have estrogen. Women need testosterone as they need estrogen. Yeah. And if you look at the woman's body, not only can you measure good amounts of testosterone, but also women have all the receptors, the parts of the body that recognize and respond to testosterone. So they have these receptors in their eyes, in their brain, in their bones, in their red blood cells, in their breasts, in their genital tract. So they are important.
Yeah.
The very fact that there is this huge distribution of receptors for testosterone means that the testosterone is an important hormone for women.
And not just necessarily for libido either, I think.
Oh, absolutely not. So some of the things that it does do is that it will improve a woman's sleep. Some women are troubled by brain fog.
Yeah, I have that a lot.
And when they use testosterone, they find that it significantly eliminates it.
Yeah.
And of course, there's the energy levels issue. So a lot of women find that they're not as energetic as they were before the menopause, and then they get a bit of testosterone, they're energetic, they can go to the gym, they can do all the things that they've always wanted to do. And then finally, something that is very difficult to measure, but a sense of well-being.
Yeah.
A lot of women taking testosterone report this. I feel so much better in myself. I can't put my finger on it, but
it's
I do.
Joy for life, isn't it? I think it's that zing for life that you can't measure, you can't put into words, but it's just that little zing that you get for living and doing things, I think.
Absolutely. And
I think in terms of when libido dips, once you've sort of gone through with that, so if you have a rise, if you then drop down again, I think once you've got all those other things in place, so if you've got sort of the zing for life and you've got the energy levels, then surely that might come first before the libido, because if you're tired, you're not necessarily going to have desire anyway. So getting all those other things in place as well is going to be beneficial for then improving libido as well.
I couldn't agree.
Yeah,
absolutely.
It's kind of libido is sort of the last thing, I suppose, on the list. Getting all those other building blocks in place will then potentially improve your libido after that, because you've got that joy for life back and your energy and everything back.
Yeah, absolutely. Now, Gavin, can I just mention something about the way this testosterone, those women who need it, how they can administer it? Is it something we can do? So at this moment in time, in the UK in general, a lot of women who have become aware of the potential benefits of testosterone may go to their GP, and a friendly GP will say, oh, yes, I can give you testosterone. But for most GPs, the testosterone they have access to in terms of what they can prescribe is the testosterone that's normally prescribed to men.
Yeah.
Men who have low levels of testosterone and who need this testosterone. And this testosterone can come in all forms, like it can be a gel or a cream, or men, it can also be an injection and so forth. So women are often offered the male preparations, and it's estimated that they need about 1/10 of what men use. So, for example, if they're using sachets of testosterone, where a man can use one whole sachet, that whole sachet can be used by women over a 10-day period. The difficulty is that it's difficult to really measure and get the right. And you're being told, oh, just use a pea-sized.
Yeah.
I don't know what a pea-sized is all about. I tend to see
what kind of pea?
Exactly. So that's part of the difficulty in giving effective testosterone supplementation.
Yeah.
Once upon a time, there used to be a patch.
Yeah, I've heard of those.
Yeah, and it was discontinued in 2012 because the company that was making the patch was not making enough money. It was never about whether it was effective, because it was very effective. It just wasn't making enough money, because at that time, not many women were using just HRT, never mind using testosterone specifically. But now they are developing another patch. It's undergoing clinical trials, which started in 2023 April, and hopefully sometime soon it'll be back on the market.
Yeah, that's really exciting, isn't it?
Yeah, it'll be specifically female developed. It'll be developed, for use by females, rather than trying to use male preparations.
So that's sort of changed as your normal estrogen patch would be then? Just change it, Yeah.
So at the moment, what is available that is female specific are, number one, the hormone implants, and number two, there is a gel called Androfen that comes from Australia. Those two are very female specific, and in my experience, most women don't have any difficulty settling on them because the doses have been tested and tried, and there is a good amount of information on how they work, and they are very, very, very effective. But the gels, as I said, that are predominantly male type gels or the creams and so forth, are a little bit difficult. They work mind you. I don't want to give the impression that they don't. It's just they're not as easy to use as.
Yeah, so I guess there's more room for error with the dosing and things. So you may not be getting enough, you may be getting too much.
Indeed.
Yeah.
Indeed.
Yeah, so that's maybe an option then. So if some women are struggling with that sort of decrease, that's maybe an option that women can look at, maybe speak to the GP about, see if they would prescribe it, if they're finding that it's a symptom and they're struggling with it, with the testosterone route.
Yeah, it's also an issue of the GP being open-minded about it and happy to support a woman in what can be a very challenging time in a woman's life, and recognizing that, because there are sadly some healthcare professionals who will dismiss women. You don't need testosterone. Your mother had her menopause naturally. She didn't need to take anything. Why are you finding that you have to take something? So that's not uncommon an approach.
No.
Sadly.
No, I've heard a lot of that.
Well, there you are.
Yeah. It's really sad, isn't it? Because I think women are already vulnerable. They're in a vulnerable state. They may be, suffering with brain fog. They're not thinking clearly, and then they're dismissed straight away. And,
and if we remember that around the perimenopause and menopause, mood changes can be quite profound. Depression can be quite a common symptom. The sad part is that we tend to rush to give women antidepressants.
Another thing I've heard a lot as well,
which often do not address the underlying problems that they have, because what they are actually needing is not an antidepressant, but what they are needing is a bit of hormone replacement. So a lot of women will have a lot of anxiety, which you give them a tiny bit of estrogen and it lifts. While we're thinking about I just wanted to say a little bit about implants. Because it's just important for people to know. I mean, these whole things about, educating the public and sharing information, sharing
having the options and knowing and the information available to them that they might not necessarily get if they went to their own GP. They might not necessarily.
Absolutely. Now, implants is a way of giving HRT as tiny little pellets that are put under local anesthetic under the skin. It takes about 10 minutes to do, even less. But both estrogen and testosterone can be given as these tiny pellets, which are the size of a grain of rice. And these pellets last 6 months. So you have the advantage of not worrying about putting creams or patches or anything for 6 months, and then just replacing. So twice a year, you can get your HRT that way. Now, if a woman happens to have a womb, she will need something to protect the lining of the womb. So she needs progesterone. And if she has a coil, the Mirena coil put in, that Mirena coil produces local progesterone, and that Mirena coil lasts for 4 years. So twice a year she has the implants done, and every 4 years she has the coil replaced. And to my way of thinking, that creates a huge convenience. I mean, I accept that some women actually like putting, creams and gels and so on, and that's fine. All I'm saying is there are other options. But there's also another advantage to the use of implants, and this is that there are women in whom absorption of creams and gels through the skin is not very good. So you end up needing to give them very high doses in order to achieve the effective levels. Well, the implants get around that problem. And by the way, implants have been around for years, since the late 30s. So they are well tested and well tried, and they work. And so, I mean, I just always like for people to be aware of all the options that are open to them. As I say, there are those women for whom applying the creams or the gels is part of their daily routine, and they enjoy that, and they should stick to that. If it's working for them, there's no reason to not continue. Why fix something if it's not broken? So, but people should still be aware.
I think every woman's so different, and what works for one will not work for another.
Indeed.
You need that option of trying different things if it hasn't worked, and I think it's good to be informed. Is this something that the GPs would do, the implants, or is this a private?
No.
So it's a private.
It's not necessarily private, in the sense that there are some hospitals that do offer implants. I hope they don't mind my saying so, but the Chelsea in Westminster, for example, their menopause clinic does offer implants. St. George's Hospital used to offer implants. I'm not sure whether they still do. King's College Hospital in fact, King's College was probably one of the pioneering places in the 70s that pioneered the use of implants. So again, it's been, they've been around for quite some time. People should be aware of the options, and they should be able to make up their minds whether those options are something that they would wish to explore for themselves.
Definitely.
And so forth. I mean, the other thing to emphasize, of course, is the fact that the knowledge is very clear that safe HRT should be given through the skin, either as a patch or as a cream or a gel or a spray. and that taking by mouth really is problematic.
Yeah.
In part because the medication then goes into the stomach through the liver and is metabolized, and some of the products of that metabolism contribute to risks of blood clots and so forth. Mm. Whereas when you put it through the skin, it's going directly where you want it to go, and it is considered much safer.
Yeah. I think there's still a lot of women, I think, still worried as well about that, isn't there? I think the risks and things, I think it's still in a lot of women's minds, even though it's, spoken about now as being safe. I think still women. I think particularly when you open a box of HRT and you see that really long leaflet, you start to look at, I mean, that's enough to scare anybody, isn't it?
It is. But if you opened the paperwork that accompanies aspirin, okay, you will find a whole list of things too. So I'm not saying that there's anything that's completely risk-free.
No.
What I'm saying is that the manufacturers of a lot of medicine, they protect themselves by coming up with this whole realm of things.
So have you got any top tips that you might want to give to ladies who are perhaps struggling with libido, or what you could sort of recommend to them? We've talked about the benefits of testosterone. So things like, first of all, communicating, tracking the symptoms, what kind of thing would you suggest that they do?
Yeah. So here are the points I can very quickly make. The first is, you asked us to discuss the issue of this transient rise in libido and then the profound fall. To say that, to reassure women that that's not uncommon, it's not a pathology, it's not an illness, and the reasons for it are much more to do with fluctuating and high levels of testosterone, which then fall, but not to be worried about. But when it does fall, when the libido does fall, that there's help out there. And the International Menopause Society recommend the use of testosterone for poor libido. So it's not just something that Catherine and Isaac are talking about. It's something that actually the International Menopause Society actually recommends. What it doesn't recommend is the other indications which I, as a practitioner, quite often observe in the majority of my client population. And that is to say that women often find benefits in areas such as libido, brain fog, energy levels, sleep, and a sense of well-being. Mm. So these are the other potential benefits. Yes, a lot of research is required, but these are observations of real life events.
Yeah.
Testosterone, how is it given? It can be given as a cream, as a cream, as a gel, or as implants. And there are many advantages for using implants, but they are costly. And a patient's GP is more likely to be able to give them creams or gels. And they shouldn't hesitate approaching their GPs to have a conversation about it.
Yeah. So I think the key is really communicating, isn't it, really? I think it's being aware. So there's lots of symptom tracker sheets online that you can download and get all those symptoms ready to take to your GP, I think. And just being armed with that knowledge. Because is it sort of possible that if you've got that rise in libido, it's kind of a little warning sign to maybe some ladies saying that perimenopause is knocking on your door? Kind of be prepared, track those symptoms, so then you've got that awareness ready to take to your doctor and say, I'm struggling with this, or could you help me with this? Having that conversation with your partner as well, saying this is what might be happening, just so you know what's going on with me. Just being
absolutely
aware.
Yeah.
Brilliant.
Okay.
Thank you so much, Professor. It's been really, really useful. I think there's going to be a lot of ladies out there who perhaps don't feel as alone, because I think talking about libido there's still a lot of stigma around it. Women don't really want to talk about it. I think there's still that taboo around this area, which is probably why a lot of women don't necessarily say what's going on with them, and perhaps why it's not spoke about enough, this increase in libido. Perhaps there is lots of women out there who it does happen to, but they've not come forward and said because maybe they're just a little bit too embarrassed to say. So
Yeah.
I think it's really important to highlight that. So I'm really grateful for you joining me this morning and talking about it.
Pleasure is mine.